I'm Dr. Lauren Bramley, and I'm a fellow with the American Academy of Anti-Aging Medicine. That's called A4M. And I'd like to tell you a little bit more about how anti-aging works in our practice. We've evolved a really multidisciplinary approach, a team approach or shared care, and I'd like to introduce you to the specialists and practitioners that we have in our clinic. So we have myself. I have a master's degree in endocrinology, diabetes and metabolism from the Chinese University of Hong Kong, and I'm also a fellow with A4M. Dr. Stephen Leung has joined us. He's had a long career in neurology and neurosurgery, and he also has taken a lot of fellowship courses with A4M. He's very interested in anti-aging and men's health. We also have Dr. Stephen Kirkham, and he's currently taking the stem cell fellowship. And we've just started using stem cells, whether it be for aesthetic reasons. We're getting excellent results for that, but we're also looking at it for chronic illness and the tremendous benefits that stem cells can offer for patients with those conditions. And then a number of our GPs are also interested in the anti-aging aspect and have done a number of courses and certifications through A4M. We have got Dr. Nicholas Salmon, who has a certification in dermatology and special interest in that field. We've got Dr. Gerald Wong, who speaks Cantonese and English. He also has child health certification and certification in gerontology. And we've got Dr. Winnie, who has really advanced aesthetic skills and has also had A4M certification in aesthetics. We're also very lucky to recruit a new doctor, Dr. Charlene. She just recently completed her LMCHK, which is her certification for Hong Kong. And Charlene brings to us a very experienced background in emergency medicine and intensive care medicine and has a very vast knowledge. We're very fortunate to have her join us. Josephine comes to us from London. She is a specialist in nutrition, and she can really evaluate the diet. She does it from an anti-aging approach and gets excellent results for people, whether it be weight management or people who are trying to gain weight or people who just have issues with their GI tract and bloating and whatnot. She uses very integrative testing and a number of excellent supplements to get really good results for people. We do our IV nutritional therapy. Myers cocktails, probably our most popular. We do IV glutathione, and these can really complement, especially for issues with fatigue and autoimmune issues, adrenal fatigue. IV nutrients can really have a lot to offer. Our pediatrician is Dr. Ken Chan, and he brings to us an excellent background in intensivist pediatric care. He is able to admit to the local hospitals and sees patients in our practice. He delivers the babies for a lot of our pregnant women and sees them as infants and then as toddlers. We have Dr. Damien Mouliak, who is an osteopath who comes from Australia. Dr. Damien speaks French, which is a huge asset, and he does our osteopathy. He has a doctorate in osteopathy. Damien can get excellent results. If you've found to have a hormonal imbalance, he approaches his osteopathic treatments in a way that can actually improve your hormonal status. Being interested in thyroid and how important thyroid is, whatever manipulative techniques he's using can really optimize your thyroid without necessarily requiring medication. Damien also is our PRP specialist, and he's fully qualified in administering PRP. So Damien's actually an integral part of our practice, and we're very fortunate to have him. He gets excellent results. Brendt Reynolds from Australia is our traditional Chinese medicine practitioner and acupuncturist. He's excellent at solving a lot of really hard to crack disorders like sleep disorder or cigarette smoking. He also does a lot of facial rejuvenation. He does acupuncture, the acupuncture facelift, which gets tremendous results. Brendt has an amazing way of dealing with edema and a lot of lymphatic disorders, which really complements our practice. The most recent member of our team is Chris Manton, who's a naturopath from Australia. He calls himself the health detective, and that's really what he is. When we can't figure it out, we send you to Chris and he'll figure it out. But actually, Chris is excellent and does a live blood analysis. He also does a dried blood analysis, and it's often through analyzing your blood cells, how they flow, the shape, proteins, whether they be good proteins or unexpected proteins in your blood. Chris can help us diagnose a lot of ailments which are really plaguing a lot of our patients, such as leaky gut syndrome, and what to do about it. He's also passionate about the pollution problem in Hong Kong, and the toxicology aspects of that and how it can wreak havoc on your immune system, on your adrenal system, be a huge contributor to fatigue. Also, the chronic dehydration that so many of us face. And you can get so many excellent improvements in your health just by restoring your hydration. And that's exactly what Chris does. So he's a huge asset. So we're really pleased to have the health detective. We also have Dr. Juggy, Sidhu and Leslie Lewis, and they make up the psychiatry-psychology part of our practice, also with the anti-aging approach in mind. Dr. Juggy Sidhu is a trained psychiatrist and licensed in London in UK, and he uses a really integrative approach. So whether it be fatigue, whether it be depression, anxiety, any psychiatric condition, not only is he using traditional psychiatric modes of treatment, but he also uses our integrated modes of treatment, which is so important, and feeds back to us. So there's a definite interplay to help people get the best treatment for these conditions. Leslie Lewis is our psychologist from the US, and she's got over 25 years experience working in Hong Kong for all kinds of problems, whether it be couples counseling, depression, cognitive behavioral therapy. Leslie Lewis has so much to offer for counseling for patients. Our dentists are Dr. Sarah, who's trained in Hong Kong, and Dr. Yvonne, who's trained in Australia. And they do all forms of dentistry with an emphasis on cosmetic dentistry. They use outside orthodontists, but they can handle a lot of problems that might fall under the anti-aging, such as bad breath, halitosis, cosmetic teeth whitening, or removing fluoride stains or tetracycline stains, heavy metal stains from teeth. They can also replace mercury amalgams, which can have a lot of contributing factors to autoimmune disorders and rising mercury levels. One of the great things to evolve in our practice is our own in-house lab, known as a pool. Those are physician-owned and operated labs, which make complete sense because we've been able to, with our own lab, have our own reference ranges, which are more in the anti-aging values, more optimal lab values, which makes sense for people. So they can see where they really fall. It may not be abnormal by traditional testing, but if it's very, very low, borderline low, they can see the advantages of improving those lab values. We can get our lab values back in a matter of minutes, sometimes 20 to 30 minutes when we need. So we can do basic biochemistry in-house, we can do full hormone profiles, cancer markers, blood count, urinalysis, all available in-house. For more specialized labs, we pick and choose our suppliers of these labs and can handle samples that we send all over the world, to the UK, to the US, to Australia, whether it be gene testing, salivary hormone testing, 24-hour urine hormonal testing, gut dysbiosis testing. We can handle all of this kind of testing and make sure that we're getting really good quality results quickly. We have Peter Walsh, who is our lab director. He brings us years of experience and has a great interest in anti-aging medicine, and his assistant Rachel. And our pharmacy, which we are able to dispense most conventional medications used for family medicine, but we also stock all of the vitamins, the minerals, the nutraceuticals that we recommend. And this is a constantly evolving process, as is the field of anti-aging medicine. We will pick and choose which supplements we find are the best, which are the best tolerated, which get the best results, best doses, and actually make a difference. So we choose our supplements that are going to most suit people and get the best results. We also have a very loyal, supportive, and efficient support staff. The receptionists, the nurses. Our nurses attend a number of the A4M conferences so that they're really up to date on the information that is their job to pass on to you, whether it be lab results or explaining the nutrients and supplements that we've advised. Our nurses really have an excellent handle on what our approach is, what results you can expect, and they're able to field your questions. If there's something they can't handle, of course they consult the rest of the team, but our nursing staff is superb, as are our receptionists. We try to help the patient with a multi-team approach and guide them as to where they can get the most benefit, whether it be addressing their sleep problem, their nutrition problem, their hormonal imbalance, maybe a bad lot in the genetics. Whatever it may be, there's going to be a solution, and anti-aging can offer that. If you'd like to find out more about the practice, or you have a specific problem, one of the best ways to get in touch with us is to call us at reception, or to go onto our inquiries page on the website, where we will field your inquiries and direct you to the right practitioner that we believe would be best suited as a starting point. If you're still not sure, just come in and see any of our doctors, because we're all happy to guide you and we all work very well together, sort of a shared care approach.